officer proclaimed a local emergency. We're here today pursuant to the Health and Safety Code Section 101080 and the California Government Code Section 8630 to request that your board ratify the declaration and proclamation, as there is a continuing need for the local health emergency and local emergency. I am joined today by our Chief Medical Officer, Dr. Nick Infantides, our Public Health Officer, Dr. Wilma Wooten, and our Epidemiology Medical Director, Dr. Eric McDonald, who will provide a brief update on COVID-19 and our efforts to prevent and combat this public health threat. Dr. Nick?
Thank you so much, Nick. As stewards of our region's health and wellness, on February 14th, we did indeed declare a local emergency. As the Chief Medical Officer of this county, I believe this declaration is an act of proactive protection for our community to prevent the preventable. Declaring a local health emergency and local emergency empowers the county to more effectively respond to COVID-19, to seek and to utilize mutual aid, and to ensure that the county's health professionals and other local stakeholders have all the necessary tools at their disposal. This includes supporting our local hospitals with bed capacity and supply availability, including things like the protective N95 respirators. And finally, to enhance our authority to seek reimbursement from the state and enhance our capacity to draw down additional resources from the state and federal governments. In December of 2019, a novel coronavirus, now called COVID-19, was first detected in Wuhan City in the Hubei province of China. Since then, the virus has spread to over 75,000 cases worldwide, including over 2,000 deaths. To put our local declaration into context, on January 30th, 2020, the World Health Organization declared COVID-19 a public health emergency of international concern. The next day, on January 31st, Health and Human Services Secretary Alex Azar declared this global outbreak a public health emergency for the United States. The County of San Diego has made swift and significant efforts to address the potential impact of COVID-19 outbreak locally in order to protect and preserve our public health and safety. State law requires that both the declaration of local health emergency and the proclamation of local emergency be ratified by you, our Board of Supervisors, within 7 days of issuance. Today's action requests the Board to ratify and find that there is a continuing need for both the declaration of local health emergency and proclamation of local emergency. I would now like to turn it over to Dr. Wilma Wooten, our Public Health Officer.
Thank you, Dr. Infantides. Based on CDC guidance, the following groups are at risk for COVID-19. The first group includes those who travel to the U.S. from Wuhan City of Hubei province within the last 14 days. The CDC has designated this group to be high risk. Individuals from 2 flights were on mandatory federal quarantine at the Marine Corps Air Station in Miramar. On February 18th, 166 out of 167 repatriates from flight number 1 were released from Miramar as they have completed their mandatory quarantine. On February 20th, approximately 63 out of 65 repatriates from flight number 2 are planned to be released from quarantine. Of the total 232 repatriates from these 2 flights, there were 2 positives and 1 exposure to a positive. The latter is currently quarantined until February 24th. The second risk group includes those who travel from other provinces in China within the last 14 days. The CDC has designated this group to be at minimum risk. These individuals are funneled through one of 11 U.S. airports and screened for symptoms at the airport. If they have no symptoms, these travelers are on home quarantine with self-monitoring and under the supervision of public health services for 14 days. The third and last risk group includes close contacts with an ill person who recently traveled from China. These individuals are also at medium risk. An example of this would be a spouse, family member, or other close contact exposed to a confirmed case. Specific to San Diego's efforts, it is noteworthy to mention that the County Medical Operations Center, or MOC, was activated at level 3, which is the monitoring phase, on January 21st, with the first COVID-19 case reported in the United States. This action was followed by distribution of the first KHAN to our medical provider community on January 24th, development of the County of San Diego COVID-19 response plan on January 27th, activation of the MOC to level 2 on February 1st. We have been working with federal and state partners to receive the repatriated flights on February 5th and February 7th, respectively, and working with the local healthcare partners to facilitate care for these evacuees. From this group, San Diego County had 2 positive COVID cases on February 10th and 11th. Through these federal, state, and local partnerships, we have successfully protected the residents of San Diego County as well as the repatriated citizens. On this past Friday, the county declared a local health emergency and local emergency to ensure that all tools and resources are available to the county to monitor travelers on home quarantine, enhance laboratory capacity, and respond to unexpected events that may occur in the future. This graph shows the key actions taken by the county in response to public health threats in general. In the case of COVID-19, since January, the county continues to conduct surveillance for early detection and control of COVID-19, conduct investigations to determine the exposures and risk factors of COVID-19, including the monitoring of returning travelers from China who are under self-quarantine for 14 days. We have also established testing capacity within our public health laboratory to perform diagnostic testing of patient specimens in partnership with the CDC. We are developing or have developed targeted communication specifically to healthcare professionals through KHAN health alerts to various sector groups via specific letter communications and the general public via the website at www.coronavirus-sandiego or -sd.com and through 211 San Diego activation of the call center so the general public can call and get information if needed. We continue to develop and distribute health promotion materials such as fact sheets and frequently asked questions, as well as conducting clinical and community presentations provided upon request. We continue to coordinate and collaborate efforts between County Public Health Services, Emergency Medical Services, and the Office of Emergency Services with our local healthcare, military, law enforcement, city municipalities, schools, and community partners for a proficient emergency response. We would like to thank federal, state, and local partners who enable the county to collectively respond to this public health threat in an efficient and effective manner. Specifically, thank you to our healthcare partners, which include Rady, UCSD, Sharp, and Scripps. Separate from the individuals under mandatory federal quarantine at Miramar, who have a travel history from other provinces in China, these are designated by CDC as medium risk. In monitoring these individuals, our county epidemiology program staff members are following CDC guidelines for management of asymptomatic individuals. Again, these travelers are on home quarantine, self-monitoring for 14 days under public health supervision. Prior to current travel restrictions, 14,000 to 20,000 individuals traveled from China to the U.S. on a daily basis. After travel restrictions, the United States has received approximately 2,000 daily travelers from China. Since February 3rd in California, there have been 6,390 travelers from China. Of these, 248 travelers were to San Diego, which includes 81 individuals who have finished their home quarantine period. We continue to obtain a daily list of approximately 20 to 30 names of individuals who are at medium risk and require public health supervision. Public health monitoring may include check-ins, medical care, transportation, and other daily needs. This table shows a summary of the total number of cases of a patient under investigation, or PUI. As noted, there are 4 categories. San Diego resident PUIs, where there have been a total of 7 cases with 1 case pending test results. The second category is non-resident PUIs. There have been a total of 1 case with none pending. Federal detainees includes 3 PUIs and none are pending. And lastly, federal quarantine PUIs, where we have had 13 cases, 2 positives, and 11 were negative. As the county responds to yet another unprecedented public health threat, it is important to emphasize that the public health risk for COVID-19 to the general American public, including San Diego County, is low. In comparison, the risk of getting influenza is much greater. As such, it is recommended that everyone obtain their flu vaccination. However, there is currently no vaccine available to protect against COVID-19 and may not be available for at least another year. Last, to prevent exposure, CDC recommends avoidance of non-essential travel to China. In summary, the health risk for COVID-19 to the general public is currently low. Travel from China or close contacts with an ill person who has recently traveled from China is a key factor in determining risk. All 15 U.S. cases of COVID-19 are travel-related or close contacts of those who have traveled from China. There is limited person-to-person transmission in the United States, with only 2 of the U.S. 15 cases caused by close contacts or by exposure of a close contact with a confirmed case who traveled to China. Due to the ever rapidly changing events related to the global COVID-19 outbreak, actions to declare a local health emergency and proclaim a local emergency position the county to more effectively respond in collaboration with community partners. Please welcome Dr. Ifantides for closing comments.
Thank you so much, Dr. Wooten. So Chairman Cox and members of our board, today's proposed action of ratifying the local health emergency and local emergency ensures that the county is prepared and protected from the emerging COVID-19 global outbreak. As we continue to coordinate a regional response, our internal and external efforts with many county departments, as well as our federal, state, and local partners, continue to be critical to achieve a successful COVID-19 response. This concludes our presentation, and we are now available to answer any and all of your questions. Thank you very much.
Thank you very much for that very concise report. Again, I guess the lesson here to learn or to really focus on is the fact that the health risk for COVID-19 to the general public and to the citizens of San Diego County is very low. Obviously, the action that we're being asked to take today to ratify the declaration of local health emergency is a precautionary action. And I just want to thank and commend our Department of Public Health for the job that they've been doing. I know they've been working hand in hand with the Center for Disease Control. I know there's been a couple of different press conferences to get information out to the public. And the collaboration and cooperation, I think, that we've seen from the national level, the state level, here to the local level of the county has been exemplary. And I just wanted to commend the Department of Public Health, Dr. Wooten, Dr. Nick, Dr. McDonald, and all the rest of the team for the great job that you're doing. I know we have some comments or questions from some of my colleagues, and I'll start with Supervisor Jim Desmond.
Thank you, Mr. Chair, and I want to say thank you very much to staff for your input and actually taking a proactive than just a reactive approach to this COVID-19. And I'll be supporting the local health emergency that's going to actually help us more effectively respond to COVID-19. But I've got three questions, one of which is you talk about our many partners, the federal and the state. We're a binational region, and we've got about 100,000 people coming across the border every day. So what is the federal government, if you know, what's the federal government doing to ensure that we have enough resources available at our border for screenings if necessary to assist and make sure that we keep San Diegans well?
I will respond to that, Supervisor Desmond, by saying we have been in very close collaboration with both ICE and CBP. As far as the resources that they are making to their own folks, obviously we would defer those questions to them. But I can tell you, and I don't know if Dr. McDonald would like to add a comment, the collaboration between us and the appropriate federal partners has been exemplary.
Okay. Well, maybe you can answer it. I mean, beyond ICE and Corrections and Border Patrol, beyond that, I mean, just regular citizens coming across as well.
If I can address the specific question about what DHS is doing, there was a conference call actually 2 hours ago with the Chief Medical Officer of DHS, the Chief Medical Officers of CBP and ICE, and also all the state partners along the border to actually ensure that we have a robust plan to be able to respond to anyone who has a travel history or any frank concern about COVID-19 who presents at the border. They do have policies and procedures in place already to identify individuals who might be medical risks, but this is a special category that requires isolation, handling, perhaps evaluation in the local medical community, perhaps even testing, as has resulted in 3 of the cases who presented in ICE custody. And again, we are working together with our state to make sure that those policies and procedures are in sync so that individuals don't show up at local EDs and cause any difficulties. But I think there is a strong effort occurring there. I couldn't really address the larger issues about what the Department of State is doing with Mexico and other countries that may have individuals coming from China and other affected areas, but I would just defer it to them.
Well, and I guess as a follow-up to that, we've also got co-terminal, airport terminal across the border with Tijuana. It's at Rodriguez Field. I'm just wondering if there's any potential screening or what are we doing? Is it similar actions as to the border itself? But I'm just kind of curious. We've got that co-terminal, and it's we have flights from China don't come in and out of here because of our runway, but Tijuana has those. Just curious, what are we doing for screenings there?
We have had very close contacts with our colleagues in the state and local health departments in Baja California, and I know that our state has also had connections as well as the DHS with Mexico City. There are no longer direct flights from China going into Tijuana. Those were suspended over 2 weeks ago, and even before they were suspended, the Mexican health authorities actually used screening procedures that were almost identical to the CDC procedures for incoming individuals for travel screening. So now I think the route is really in other parts of Mexico with individuals perhaps coming with travel histories. Some of those individuals may make it to our border, and of course we are making sure that none of those individuals have signs or symptoms that would be concerning for COVID-19.
All right, thank you.
Okay, Supervisor Fletcher, you have some comments?
Yeah, you mentioned the local testing. I wondered if we know, do we have an update on when we think we might have the capacity to do local testing so we don't have to send it to CDC? I know we've been working diligently on it.
So currently, there's a holdup from CDC with obtaining all of the components necessary to run the test. And until we get all of those components and then conduct validation studies to ensure that validation tests to ensure that the tests are reliable, we will not be ready. We anticipated it could be several weeks yet.
Do you know, it would seem like we would be at a priority standpoint, just given the number of folks that were flown here. There's only 3 locations, I believe, that folks have been flown in, plus the prevalence of the border and the other ties. I mean, is there any guidance from CDC on the priority on who gets those components?
Well, we are one of the numbers of public health laboratories that have been designated to conduct these additional tests, so we are in that priority group. But again, it is contingent on us getting the appropriate materials to run the test, and that is now in CDC's court. And then when we get those materials and run the necessary validation tests, then we will be up and
Be
running.
able to do it. And I imagine they're in a crunch from a lot of tests from a lot of places, so certainly if we have that local capacity. You know, I fully support what we did, and I think it's vital that we do everything we can, and while the risk to the public remains low, I think it's appropriate as a county and as the chief, you know, core obligation about protecting public health that we're proactive, we're vigilant, we're transparent, and I think this action empowers us to have every available tool to do everything we can to protect the public. And so I appreciate Dr. Wooten and Dr. Impantidis and Dr. McDonald for everything that you're doing daily. I know we've had good communication with the state Department of Public Health and with the CDC and their turnover and transition with new folks, but regular communication there. And then we're obviously grateful for the Marines for providing hospitable care to folks going through difficulty, and of course our partners with UCSD and Rady and everyone else stepping up. So support this action, and we'll remain very committed to doing whatever we can to make sure we protect the public. So thank you all.
Supervisor Jacob.
Thank you, Mr. Chairman. Just a couple of questions. It was mentioned that travelers from non-Wuhan provinces of China and without symptoms upon entry, they're going through 11 different airports. Do you know which airports those are?
Yes, there are 2 in California, and that includes San Francisco and LAX. San Diego is not currently in the list of airports.
And the others are other parts of the country?
Other parts of the country, Seattle, Chicago, JFK, and I forget the others, but we can get you the list of the 11.
Thank you. And my second question has to do with a vaccine. I have heard on the news and I've read that there's a vaccine in the works. Are there any updates on that we know of as we sit here today?
Thank you for that question. I think we have heard the same media reports. I haven't seen anything come officially through public health channels that confirm those reports, but I do know that the companies that are involved that have been publicly announced who are developing those vaccines are similar to the companies that developed the successful Ebola vaccine, and that was rapidly developed and in fact extremely effective in assisting with controlling that outbreak. So we are very hopeful, but developing a vaccine based on a platform is what was announced. The next step is to be able to manufacture it enough in quantity and then put it in the arms of individuals who might be at risk. Primarily that'll be in China and perhaps other countries, but and perhaps in healthcare workers. And then we need to see if indeed it's effective. And I think that process will take some time. We're all hopeful that it may be within a year, but we really just don't know.
Thank you. Thank you for that. So not anytime soon? No. Okay. So get your flu shot. That's the main message today, and the low risk. And I, along with my colleagues, I'm very grateful to all of you that have taken swift action to engage on this particular issue, which could become a huge public health threat in our region. And as I sit here today, I believe on what I've heard that we're taking every precaution possible, but we've got a community out there, we have people out there that need to be diligent also and report and be the eyes and ears if they suspect that they or someone that they may know or come in contact with has the symptoms for this virus. So thank you for your work, and since no one's made a motion, I will move to ratify the proclamation
for knowing what the test results are, positive or negative.
Great, thank you. Well, I hope we're successful in being able to perform that service here locally. Is there any further discussion? If not, we have a motion by Supervisor Diane Jacobs, seconded by Supervisor Jim Desmond. Please vote.
Mr. Chairman, I'll just clarify for the record that that motion includes all of the recommended actions in the board letter. Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
That is the only item on our agenda today. However, I would take this last opportunity to remind everybody that the State of the County tonight is at 6:30 on board the USS Midway. Should be a fun event, and we hope to see a lot of people there. This meeting is adjourned.
The next regular meeting of the board will take place on Tuesday, February 25th, 2020 at 9 a.m.